Um, but what about healthcare? We see a lot of bots or a lot of even AI agents being developed for the health and wellness industry. People are using it for therapies. People are using it for conversational AI,
Hmm.
or maybe to take an advice, maybe to talk to. So how is that going on? Any experience, any examples, or anything you want to highlight around healthcare?
Yeah, really insightful. Healthcare is a very broad subject, right? So you've got physical health, you've got psychological health,
Yeah,
you've got
mental health. Yeah,
alternative, yeah, mental health, yeah, alternative
yeah, yeah,
therapies.
yeah.
Um, now, uh, if you've got an AI tool which does diagnosis of MRIs, this could potentially lead to all sorts of catastrophic outcomes. Uh, there's a whole industry built up around this to protect these physical products. I would think that it's a lot. The, medical instrumentation that's already got a lot of existing regulation around it. That's a whole other area of compliance. If you're talking about uh, psychological, mental health side of things, this is directly applicable to the Act. So I can give you an example of this. I recently spoke to the CEO of an application developer who's developed an app which provides emotional advice. It's kind
Hmm.
of it tries to be a companion, tries to be a friend, and
Yeah,
it guides the user towards um, helping them with their anxiety, for example, or with mental health conditions. This app is a beautiful idea, and credit to the developers for thinking of it, putting it out there. But they need to be made aware that this is going. That if one of their consumers, one of their users, decides that this has given them incorrect advice, or worse, they do some harm to themselves, this firm's going to go under in a day if they're not compliant. So they need to ensure that they have made their product as safe as possible before it's made available to the users, and they need to provide a way for consumers to report serious incidents to them. So I think the healthcare industry is a lot of use cases. There's that very small niche which I was talking about of critical medical instruments, which I think is it's just uh, it's a whole other area. But there's also a giant 95% section which does need to be compliant.